In the news this week, an Afghan family pleads for visas to WA as their refugee father remains alone and dying in a Perth hospital. An exclusive report coming up.
Also another exclusive, a doctor from Bentley goes on the record over reopening delays concerning the public hospital's maternity ward. Top doctor hits out at the McGowan government over failure to provide virus hospitalisation modelling. And later, Dr Andrew Miller's comment.
This is The Evening News with Ivan Loom and Maliva Thorne.
Good evening. The family of an Afghan refugee in WA is pleading with the Albanese government for visas to enter Australia to spend their final days with their father, who is dying in hospital. He doesn't have long to live. His family overseas are worried about not being able to say goodbye. Reporter Nelson Liu is following the story and he joins us from Kalamunda Hospital with an update. Nelson, what's the latest?
Well, Ivan, time is running out for the family of Moharam Kavari, who are desperate to reunite with him to be by his side before it's too late. The clock ticking, a family's desperation to reach a dying Afghan man in WA, fighting to be by his side before time runs out.
This is not the way to say goodbye.
Moharam Kavari's family is demanding to be allowed into Australia, the father with only weeks left to live.
He's been battling with stage 4 pancreatic cancer, and at the moment he's in hospice, separated from family, and spending his last moments.
Kavari arrived in Perth in 2013 as an asylum seeker and has been working here on a bridging visa as the only provider for his family in Afghanistan. His health worsened 2 years ago, the diagnosis and separation taking a toll on him and his family.
Just torture, mentally, physically.
A ministerial intervention has been requested for him to visit his family. It hasn't happened. The only hope now is their application for visas for his family to come to the country.
I know it's tough times, but we are really hoping to, get a positive feedback.
A campaign has been established to help the family, who have now travelled from Afghanistan and are currently in Indonesia.
My aim is to help this man to pay for his family's visit in Australia, for his lawyer's costs.
Advocates say the federal government needs to act soon.
They suggest that he's got limited time. I think we need to see the department move fairly quickly.
While the family wait for the chance to be together one final time.
Help unite this family together. They've been separated for over a decade.
Now there's been a positive development, with the man's family being given approval to receive visas to come to Australia.
I'm glad they've been given approval. I think that's a really good start. I think it'll be important that they get that done as soon as possible.
It's back to you.
Nelson Liu reporting from Kalamunda Hospital. Thanks, Nelson. An obstetric doctor who formerly worked at Bentley Health Service has spoken out about the temporary closure of the hospital's maternity ward, calling for the government to reopen the facility. It comes 2 weeks after a public hospital midwife discussed her frustrations over the delay.
Rachel, thanks for talking to us. Why have you decided to speak out?
I have decided to speak out to support the local women, to make them aware of their rights and the necessity of the hospital to reopen to provide the maternity services for the women who live locally, as well as for women who would like to come and have a community experience rather than going to the big hospitals all the time.
My understanding is that the service for smaller hospitals, such as Bentley, are more niche. Now, that was your experience when you were working there. It's been closed for a while now. What are local women missing out?
The local women are missing out on the easy to access the service, whereas in example, the big hospitals, they have to drive a long distance, they have to pay for the parking, and they also are missing out on the combined resilience and the experience that the medical team that were able to provide in the past. The cultural and the linguistic diversity that was offered by Bentley Hospital medical professional team were very appropriate for the kind of woman who would walk through the door. I think in Bentley Maternity Unit, I think the important thing that I'd like to reiterate again would be the linguistically diverse team that we had. So when the postnatal care or the care during the labor and birth needed to be provided, we did not need interpreters all the time. They could just converse, and it was very comfortable for the women when they were reassured in their own language.
And how important is that for the child's well-being?
I think more than the maternal well-being comes first. If the mother is well, as you know, the child and the family is going to be well. So when there is a local community hospital providing the service with appropriate follow-up with their local general practitioners, then the women's mental health is looked after right from the beginning through the delivery and immediate postnatal period as well. So the signs of early postnatal depression or anxiety are picked up very, very early and intervened very early, which results in better outcomes for both the mother, the baby, as well as their family.
You say that women have to speak out now, and if they don't speak out, what's at stake here? What will they lose?
The loss will be, I think it's very difficult to say, but I suppose the loss would be that the, like for example, the culturally and linguistically diverse women are dependent on their partners for interpretation or for transport, and for them to take time off their work because the partners may be the main breadwinners of the family. So for them to take time off to work, to go to a different hospital, travel 20-30 k's, wait for 3-4 hours, pay for the parking, is all a major hurdle for them. If you look at it from a family point of view, a woman who could be seen in 15 minutes time has to wait for the same advice for 3 hours. And I suppose the tertiary hospitals' resources can be better utilized for women with complications.
And here are other top stories making news in Perth and WA this weekend.
The state government has updated its wage policy to a one-off $2,500 cost of living payment and additional 3% pay rise per year for the next 2 years. Public sector workers will also receive a 0.5% additional increase on superannuation per year for the next 2 years. It comes after several unions threatened industrial action over discontent with civil servants' public wage offers. A man has been shot after allegedly running towards a police officer with 2 knives this morning. The incident happened at a wheatbelt town named Bentley, approximately 150 kilometers away from Perth. A taser was deployed and failed to subdue the man before the shot was fired. Investigations into the incident are underway. Western Australia's top doctor has hit out at the state government after new revelations showing the health department has no modelling when it comes to the latest wave of COVID. As hospitalisation figures continue to climb, Dr. Mark Duncan-Smith says it's unbelievable that the McGowan government doesn't have figures, fearing that peak hospitalisation numbers will be over 600 patients.
To be this far into the COVID pandemic, and specifically this Omicron outbreak, without modelling is quite simply unbelievable. Queensland modelling, which will see an increase of 60% in the current inpatient numbers, would put us at getting approximately 600 people at our peak in hospital. The population of Queensland is double ours, and if you actually take half of where they're expecting to peak at, that would actually be approximately 800 people. Based on the Queensland modelling, WA should peak somewhere between 600 and 800 people in hospital.
Australia is joining with countries around the world to bolster its efforts against serious organised crime and transnational drug trafficking networks. The country has joined forces with the United States, Canada, the United Kingdom and New Zealand in a Five Eyes conference, with a focus on hybridising law enforcement agencies and collaboration. WA Police Force has strengthened connections with law enforcement partners around the world in recent years, including with the US's Drug Enforcement Agency and National Crime Agency. Collaborations with the DEA have resulted in disrupting drug trafficking in WA with almost $7 million, 3 kilograms of methamphetamine and 750 grams of heroin seized. WA Police Commissioner Cole Blanche says the conference enhances law enforcement in WA, preventing serious crimes in the state.
WA's Australian Christians lobby has slammed an NRL rugby team for introducing a pride jersey, claiming players wearing it are making a political statement. The lobby's WA Director Peter Albert says the Manly Sea Eagles uniform, designed to celebrate inclusiveness, is not simply a jersey. 7 of the team's players refused to wear the uniform for the team's games against the Sydney Roosters on Thursday, claiming it's against their cultural and religious beliefs. Mr. Albert says the team should have dropped the jersey.
I think that the Manly club should simply drop the LGBTQ jersey, the pride jersey. It's not appropriate to have political statements in that kind of thing. It'd be like asking them to, the players to wear a Greens or a Labor or a Liberal t-shirt.
Electric vehicles will become cheaper for Australians, the federal government has revealed, under new laws being introduced into Parliament. The legislation revealed on Wednesday would remove the fringe benefits tax to make electric cars more affordable so that more families who want them can afford them. The Act will exempt the use of eligible electric cars made available to employers to employees from the tax. It will apply to battery electric cars, hydrogen fuel cell electric cars, and plug-in hybrid electric cars. The exemption will be available for eligible electric cars with a first retail price below the luxury car tax threshold for fuel-efficient cars at $84,916 for 2022 to 2023, first made available for use on or after July 1st.
NASA is celebrating a major milestone this week by marking 25 years of the Mars Rovers program, which began an extraordinary exploration journey of the Red Planet. Launched in July 1997, the Pathfinder robot conducted experiments with the planet's rock and soil and took breathtaking pictures, stimulating the public's imagination. Although the project only lasted for 3 months before NASA lost communications with the robot, it paved the way for future probes and rovers such as Spirit and Opportunity, as scientists and astronomers prepare to send man onto the Red Planet in the near future.
Speaking of space, if you could go to any planet, Ivan, where would you choose?
Saturn will be my pick. You know, those beautiful rings, and also the fact that their rings apparently are no taller than 1 or 2 levels of a modern day building. Which is really thin, looking at a planet that is around 750 Earths. Wow. Size it is. What's your favourite?
Well, I quite like Mars.
Okay.
Yeah, I don't know if I would go there. I quite like Earth, but I think it would certainly be an interesting trip.
And looking at the pictures that you saw just now, certainly very satisfying.
Certainly very interesting.
And now, here's AMA WA spokesman, Dr. Andrew Miller, with his weekly COVID-19 update and medical commentary.
Hi, thanks for your time. Many people now coming to the realisation that these waves of COVID are going to continue, at least for the foreseeable future, and we need to take careful preparation to make sure that we're not just constantly getting reinfected. Unfortunately, a number of friends and work colleagues at the moment come in for their second and in some cases third round of COVID infection, and we don't know what the cumulative damage is going to be. So the idea is to just try and reduce the number of times you get infected where practically possible. And I'm noticing in the community a lot more people starting to wear masks in situations where they are going to be indoors in public. I think coming to the realisation that just because the government doesn't mandate something doesn't mean that it's no longer important. There's increased availability of antivirals for people now out there in the community, and you should have a plan for how to get those if you do get COVID and you qualify and become unwell. They've got to be taken within 5 days of the diagnosis. And we're calling on government also to just be much better at communicating with people around the importance of getting all of these layers of protections in place, including better ventilation and as leading by example. And we want to be seeing government buildings, for example, set up to allow work from home as well as much better ventilation inside the buildings. Thanks very much for your time.
That was Dr. Andrew Miller. And now here is Leo with what's coming up on 6 News tonight.
Thanks, guys. Today on 6 News, a referendum said to be held in this term of government about an Indigenous voice to Parliament. Anthony Albanese announcing the questions Australians may be asked, but given the lack of previous referendums that have been carried, does this one stand a chance? Also, could Dan Andrews be facing a minority government after November? New analysts showing the number of Greens MPs in the lower house could double, and it's not all good news for the coalition, with at least 4 seats at risk of being lost to Teal independents. And the clean-up continues in Kentucky, with rescue efforts ongoing amid a flood crisis. cases amid fears that the death toll will rise. You can see full details on those stories and plenty more by heading to our YouTube channel. Just search 6 News Australia to find us, or head to our website 6newsau.com. For now, though, guys, it's back to you.
Thanks, Leo, and that's our weekly news and current affairs. We have the latest news on our website, wamnnews.com.au.
Don't forget to subscribe to the WAMN Extra News Club so we can continue our work in the community. Full details on wamnews.com.au/news/extra. From Melly and myself, we wish you good health, good night. See you next Sunday.
Thanks for watching.